cracking. Hello and welcome everybody to this webinar this evening on managing football injuries with shockwave therapy. Now the webinar is going to be in two sections. We have a short presentation from Anthony, followed by Q&A / discussion about what is going to be presented. In terms of this session, it is being recorded, which you'll get access to after. So if you do miss anything, don't worry, you'll get the link afterwards and you can watch it back in your own time. If you do have any questions during the session, there's a Q&A function at the bottom of your screen. So pop your questions in there and we'll get them answered as soon as we can. For any of those who are watching on the recording, if you do have any questions, please drop us an email at info@f-ESWT.com and we'll get your questions answered as well. So quick introductions. My name is Dominic Smith. I'm the clinical application specialist at f-ESWT. For those of you who don't know f-ESWT, we are a medical technology distribution company who aim to deliver evidence-based technology from around the world into the UK. Our ethos is to bring innovative products, as I mentioned, from around the world, but not just products, also some of the leading clinicians to our education platform to share with you what's happening in the world, in the UK, from a bunch of different sectors. So with that said, I want to introduce Anthony Greenhouse, who is one of the physiotherapists at Manchester City Football Club. Don't want to jinx it, but soon to be Premier League champions, I think we can say. So Anthony, it's great to have you on. Now you have 16 years of experience in full-time football, and over the last 2 years has been regularly using shockwave therapy for the management of injuries in elite football players. Now tonight's session, to be really clear, we're going to be looking at purely the application of shockwave technology for the elite athletes, specifically football. If you're interested in the physiological impacts of shockwave, we've already done several webinars on this and we have several other informations on this. So if you are interested, we'll send you some of those links to those pre-recorded sessions already, but also feel free to reach out to us if you do want to get any access to the evidence and research about the physiology of shockwave. So with that all said, Anthony, I will hand over to you. You can go through your presentation and then we'll have a chat afterwards.
Thank you very much. Yeah, firstly, thank you for inviting me to present. Secondly, this is my first time doing an online webinar and I am massively out of my comfort zone. I've just actually had an alert on my watch saying my heart rate's gone up to 147 beats per minute. So fingers crossed I'll survive the next hour. But having seen the standard as well, some of the presenters on the previous webinars, I do feel a bit out of my comfort zone. So I hope you're not too disappointed with what comes over the next hour. As Dom said, I've worked at Man City now for 13 years. I did just over 10 years at the academy. And then the last 2.5 years, I've been with the first team. And it's during this time that I've been introduced to shockwave therapy. I was originally shown how to use the machine during an in-house training session. So I just want to point out that I am far from being an expert or an aficionado in shockwave therapy. I'm not a researcher. I'll be honest, I'm not a fan of reading journals. And again, having watched some of the previous speakers on some of the webinars, and now don't consider myself to be particularly clever. I'm just a physio with access to the shockwave therapy, and it is just one of a few treatments that we do at the club. My experiences are purely anecdotal. They're based on what I've seen and not necessarily evidence-based. Personally, having used the shockwave over the last couple of years, I do like it. I think it's a very simple to apply piece of kit and it produces very good results. That's one of the main points that I want to get across today. And then as well as just showing how we sort of integrate it into our daily treatment sessions on the shop floor, so to speak. As Dom said, I'm not going to talk about the different types of shockwaves or how shockwave works. In a nutshell, for me, keeping it simple, this is it. It's a non-invasive treatment. It delivers shockwaves to the body's tissues. It stimulates a cellular level response to promote regeneration and repair. That, for me, is about as technical as I need to get. There's a lot of research and a growing body of evidence. Again, as Dom said, there's some very good webinars on the f-ESWT YouTube page. So if you want to look at that in more depth, I would really recommend it. I think they are very good. So the machine we use here at Man City is the Piezowave 2, which is focused shockwave therapy. So I'm just going to talk really about how we use it and sort of my experience. For me personally, it's very, very simple. You literally switch it on, you're ready to go. There's 6 buttons on it, so it's not like a spaceship like some of the kit that we've had in the past. You basically have a frequency, which is how many shock waves are delivered per second. You've got the intensity to show how strong the shock waves are. And then you've got the shock counter, so you know how many shock waves are actually being delivered. Also, the intensity can be changed from 0.1 to 0.9. So the machine can deliver smaller doses for specific conditions such as bone healing, or if a player's got a particularly low pain threshold, you can use it for this. We quite like this as well, the intensity level. It can almost be used as a bit of an objective marker to see how a player is progressing over the treatment. So for example, if at the end of the first session, they get to level 5, and then at the end of the session, they've got to level 10, 11, 12, it suggests that their tissue tolerance is actually increasing as a result of the treatment. It gives us an idea that they're hopefully improving. A lot of people may have had experience with radial shockwave therapy. I personally haven't had much experience with it, but when I have seen it in the past, it was mainly used on chronic tendinopathies. From what I remember, it was very noisy. It did look quite brutal and uncomfortable for the player. And again, from what I can remember, the majority of the time, the players didn't want to do it again, to the point where the machine actually ended up sitting in the corner and not being used very much. So as you can see in the picture here, just the bottom right just shows you the slight differences between radial and focused. So the radial, the energy is transferred as a pressure wave and directs energy outwards, which means most of the energy is delivered superficially. Shockwave is actually the opposite. As the name suggests, it's focused, so it lets you pinpoint damaged tissues. You can target smaller areas and deeper areas. And because of that, you can treat more effectively with having minimal impact on the healthy tissue. The good thing with the Piezowave as well, where the radial wave was good for superficial or larger areas to treat, the Piezowave now has the linear therapy source, which sort of bridges the gap between the radial shockwave and the more pinpoint shockwave. So the linear head actually enables us to localize and treat painful areas, but over bigger areas, such as larger muscle groups. So we use it a lot on the quads and hamstrings and calves. We also use it to almost like a diagnostic tool, so you can sweep or scan the large areas for sensitive spots, and then when we find them, it allows us to treat that spot. We can treat the actual injured area, but then we can also treat any changes that are occurring in the tissue around them. So you might get some associated muscle spasm, and we do this alongside other treatments such as hands-on manual work. Again, because we're treating larger surface areas, linear head does speed up the treatments a little bit, so you can work a bigger area in a shorter space of time. Again, because the shock waves are focused, it means treatments are more comfortable and tolerable for the players. And as we're in a more specific area and we know what we're targeting, we tend to get more effective results. The good thing about the Piezowave 2 unit is it does have the different therapy sources and gel heads. So obviously, sorry, just going back to this one, we've got the focus, and this one's the linear. Because the players that we're treating, they vary in size and stature. We'll have some players who are very, very muscly. We'll have some players who are very skinny. We'll have areas that we need to treat that are quite big. We'll have areas that are a bit smaller, or maybe around the bony areas around the ankle. And these therapy sources and gel heads just allow us to have a greater variation of treatments. And as a result of that, it means we can actually treat more conditions, and we can tailor the treatments to specific individuals. So the fact it's not a one size fits all treatment is great, because it just gives us a lot more scope of practice. Another good thing from a personal point of view that I like is when you're doing a lot of manual hands-on work, you might not be able to get to certain depths with your hands or your fingers, or if you're doing maybe something into the glutes where it's a bit more muscly. The focused shockwave therapy allows us to target those deeper areas. And also when you're performing several treatments a day, your hands can actually take quite a lot of abuse and get quite sore when treating some of the bigger, more toned players. We've actually got 1 or 2 players where they like you to press in and try and get quite deep. And sometimes it can actually be like treating a brick wall because of that toned and that solid. And it requires quite a significant amount of force and effort. And by the end of the day, if you've done this, 3 or 4 times, your hands, fingers, and thumbs can get quite sore. So from a manual therapy point of view, from a manual therapist point of view, it can actually help save your hands, which is an added bonus to the unit. We tend to use it at start alongside diagnostic ultrasound. So we're very fortunate that our first team doctor is a very experienced sonographer and performs ultrasound scans when we need them. So if we have an issue, the doctor will assess the area, he'll look at the integrity of the injured structures, look at tissue quality, we'll come up with a working diagnosis. From there, we're then able to try and locate the precise location of the injury to see where we need to target. So we can look at the location and the depth. Again, this allows us to make sure we're more accurate in hitting the right tissue, which again, hopefully leads to more effective results. The doctor can then, throughout the treatment, perform serial scans to assess the evolution of the injury over time. Although we are aware that there's sometimes not a good correlation between resolution of symptoms and changes in ultrasound scan. But it does allow us to be a little bit more specific and a little bit more targeted in our treatments. That being said, although it's extremely beneficial to have the diagnostic ultrasound, and you can still treat most conditions without the use of the ultrasound scan. So if you've got good clinical anatomy and palpation skills, you can pretty much find the area. It tends to just be the deeper type issues or things like calcific deposits where you might need to know where these specifically are, where the ultrasound scan would be more beneficial. So we have treated a lot of different type of injuries, having gone through some of the other physios in the department. The problem with working in football is we're a little bit limited in the conditions that we see, because the majority of the injuries are lower limb based. Obviously, if you're working in private practice, you're more likely to see a much wider range of issues, and you'll see them on a much more regular basis. We predominantly use the focused shockwave in the treatment of tendinopathies, muscle injuries, ligament injuries. As you can see from the list, it does have a lot of applications. So around ankles, we'll use it on ATFL sprains, deltoid ligament sprains, ankle syndesmosis sprains. In the knee, we've used it on obviously MCL, lateral collateral ligament sprains. We've used it in the fingers of goalkeepers with collateral ligament injuries. Greater trochanter pain, again with goalkeepers when they're diving on hard grounds, it's very good for that. We've used it on scar tissue, so post-op scar tissue, the portal incisions, once they start to heal, they can sometimes still be a bit tender, so we find the shockwave is very good for desensitizing that. The fact that it's not a one-size-fits-all means you can apply it to a lot of different injuries in a lot of different areas. There are some injuries where we don't tend to use it. It's not so much that we wouldn't use it and we don't think we should use it. It's more that there's probably more appropriate modalities for that injury. One of the things we don't tend to use it for, which I need to do a little bit of research, see whether it is actually beneficial. We don't tend to use it for dead legs, but that was more on our sort of clinical judgment as to whether it would promote myositis. Again, we're not too sure about that, but even though we don't use it on the direct area, we can use it around the area on any associated trigger points or tightness that occurs as a result of the dead leg. There is evidence for intra-articular injuries, such as meniscal injuries and ACLs. But again, we haven't tended to use it on those, purely because the majority of our players, touch wood, we don't have many, but if they do sustain those injuries, they tend to go for surgery quite soon. Just when you are using the machine, it's important to note that there are some contraindications. Fortunately, we work with fit and healthy individuals, and pretty much all the time, it's not really an issue for us. If ever you are using Shockwave, just be aware of them, and if there's any doubt, obviously don't use it. So we use the Focus Shockwave both as part of rehab and also general maintenance work. So we're fortunate that we have time with the players, and we see players pretty much from day one of getting injured all the way through to return to play. And we have access to the Shockwave all the way throughout this period. So if we wanted to, we have the possibility to use the Shockwave in every phase of healing, which again increases its application. This season particularly, we only had a couple of weeks in between the end of last season and the start of our pre-season, which means we didn't really have, well, we didn't have a regular pre-season basically. So we had a little time to prepare or build up the players' tissue resilience. As a result of this, at the start of the season, we were picking up lots of small niggly injuries, so the myofascial 1A type injuries. And these are the sort of injuries where it's very beneficial in the acute phase. So your 1A type muscle injuries, or even your 1Bs and your grade 1 sprains. This is where we tend to use Shockwave early on, in probably about 48, 72 hours post-injury. And we mainly use it really just to try and desensitize the area and promote recovery and generally increase the tissue resilience. For more significant injuries, we don't really tend to use it too early. Again, just because we feel there's more appropriate modalities available. But then as time goes on, the Shockwave does become a lot more applicable. So we tend to use it a lot more mid to late stages of healing, again, to promote recovery. If it's a sprain or a strain, to stimulate collagen synthesis and desensitize areas of discomfort. It's very good when you have like a niggly chronic injury, where the players almost sort of completed their rehab, but something's still quite niggly and still experience a little bit of discomfort. These are where it's very good. And just a couple of examples where we've used it. When we first got the machine, we were coming towards the end of a player's rehab from an MCL injury. Clinically, the player was very good, and radiologically, everything was very good. Just when he was going out on the pitch and he was sort of side foot passing with quite a bit of force, he was still feeling just a little bit of discomfort over that medial joint line around the MCL. We tried different treatments. We did manual work, obviously progressive exercise, rehab, and we were taping the knee to try and prevent valgus stress, but it was still niggling and this discomfort over the medial aspect. So we decided to give the Shockwave therapy a try, and then after I think 2, maybe 3 sessions, the discomfort gradually decreased until it just completely resolved and didn't become an issue. Another similar type injury was we had a player with I think it was a grade 1 AI TFL syndesmosis sprain. Again, the player was clinically very good on assessment, good in the gym. Just on the pitch, occasionally he was still getting some discomfort over that syndesmosis joint when changing direction. So again, we tried manual therapy to mobilize the ankle. We taped the ankle to try and prevent any diastasis of the tibia and fibula. He was still feeling it, so we tried a couple of the Shockwave again. After a couple of treatment over 2 or 3 days, the discomfort had gone pretty much down, well, I think it was about a 1 out of 10 max on a numerical rating scale. And it got to the point where the player wasn't even thinking about it, and it wasn't an issue anymore. So these are just a couple of the examples where we feel the focus Shockwave works very well. Now, is it that we're putting mechanical stimulus into the area and trying to decrease the sensitivity of the injured tissue, which then means it can accept more load? Or is it a pain modulating effect? Or are we stimulating a bit of an inflammatory response and basically kickstarting tissue repair? Similar to if you did maybe a deep transverse friction. Is it a combination of all three? Truthfully, we don't really know. At the end of the day, the only thing that matters is it got rid of the players' discomfort, and they were happy to get back into training and crack on, which that's the biggest part of our job, is to get them back into training as quickly and safely as possible. Again, we use it as part of just general maintenance. Again, this pre-season, we literally had 2 weeks, and then we had to basically get cracking on with games. Barring 1 week in December and this week, we have had at least 2 games every week throughout the entire season. So a big emphasis this season has been on recovery and getting players ready to go again. So very often when we use the Shockwave, obviously it's part of the rehab, but if a player comes in with an issue, we're not necessarily trying to cure the player, but instead we're just trying to keep them ticking over. Because again, the majority of the players will have some form of discomfort for the majority of the season. In fact, it's just the nature of their job. And if you ask most of the players when they last felt 100%, they'll probably say when they were under 12s or something like that. So it is a great tool to, when a player requests treatment, it's a great tool for us to try and identify any small issues within the tissues before it does become a bigger issue. And again, we're able to sweep the area for anything, so whether it's an alteration in muscle tone, if it's a long-standing issue, we can treat anything around it. So the trigger points, if there's any trigger points around it. And this is where, if it helps the player feel better, and even if it's only 1% or 0.01%, and it makes them get as close to their 100% as possible, we're in a fortunate position that we have both access and time to do it. And these are the marginal gains that have been spoken about in different things. I think it was the British Cycling who came up with it. So these 1% make a massive difference. In terms of, do we use it pre or post training? It can be used pre-training, but we have to be confident that there's nothing significant going on. Structurally, everything is intact. So if we are considering using it pre-training, we'll always perform a full objective assessment and potentially get an ultrasound scan with the doctor if it's deemed necessary. We'll look at objective markers and performance data to get a full clinical picture. And if we're happy that there's nothing going on, then we're confident to use it. Obviously, there's the argument that pain is your body's way of letting you know something isn't right. And if anything in the objective assessment flags up, we wouldn't consider using it to try and get a player out to train. It just simply wouldn't train. That said, it can be used to provide a window for more functional work. But again, you have to be confident that structurally the injured tissue will tolerate this. So again, we'll do a full assessment, get a lot of good objective data alongside an ultrasound scan of the area by the doctor. If we're happy with everything, we'll then use the focused shockwave therapy to try and reduce pain levels, so a player can do something to lower this off. Such a tendinopathy would be a good issue, so we could use it to try and decrease the player's pain levels. Then they can go into the gym and try and do their isometric loading. Also, the 2 examples I used previously of the MCL and syndesmosis, they had shockwave prior to going onto the pitch. But again, clinically and radiologically, we knew there wasn't anything significant going on. So we were happy to use it before training. More commonly, we use it after training when a player will maybe have a niggle. That way we'll do it and then review the player the next morning to see how they're feeling. In terms of how we use the shockwave therapy, I mean, just a few things to know, which are quite important to know. A few parameters. And to be honest, when I first started reading around it, it was a little bit mind-blowing, but you have different therapy sources. So obviously you've got your focus one, you've got your linear one. You could have one of three, I think it is, on the focus shockwave. Every level has what's known as an energy flux density, which is the maximum amount of acoustic energy that is transmitted through an area of 1 millimeter squared per pulse. So basically, it's how much energy is going through at that level. So as the intensity level increases, so does your energy flux density. To get using your EFD, your energy flux density, we can then work out the total energy dose, which is basically your energy flux density times your total number of pulses. It sounds complicated, but once you've read it and get your head around it, it's not too bad. So just by changing the intensity, we can change the total energy dose. And if we increase the number of pulses, this will also increase our total energy dose. That has implications when we're trying to set our actual treatment parameters. For our parameters, sorry, this is where our relationship with f-ESWT is very good, because they actually have a lot of the treatment protocols. We can rely on them to basically give us the up-to-date research, which is absolutely great for us, because obviously when we get an injury, we need to hit the floor running, and we don't necessarily always have time to go and read through X amount of journals. That said, although we have the protocols, we often rely on our own clinical judgment rather than having set protocols. There will be times when you need a set dose. For example, with the bony injuries, tends to be lower intensity. However, as we said previously, not all players are the same. They're different shapes, different sizes, they have different tissue and pain tolerance, and they all heal at different speeds. So we start using the same settings all the time on every player. It doesn't allow for this individuality. And this is where the no one size fits all comes in again. And that's the beauty of Shockwave as a treatment and the Piezowave 2 as a unit. So we often perform our own treatment based on the individual. So in terms of number of impulses, it'll vary depending on the phase of the injury. So we're more likely to use less impulses in the acute phase, as more shocks will increase the total energy dose. And also because it may still be quite irritable, which means the player doesn't tolerate the shockwave therapy as well as they may do. The size of the area will also affect the number of impulses. You may use more impulses over a larger a larger area compared to a smaller area. The frequency, we tend to consistently use a frequency of 5. However, again, if you use it in the acute phase or if a player's tolerance is quite low, you might be more inclined to reduce the frequency so you're not bombarding the area too much. Intensity-wise, again, it's dependent on the individual. So some players will tolerate much more than others. Larger players might take slightly more. Again, everyone is different. The size of the area being treated may affect your decision-making process. So smaller areas we've found don't tend to tolerate increased intensity. So if you're going over a particular bony area, whether it's like an MCL or maybe an elbow, collateral ligament, it can be a little bit sensitive around the area. So they don't tend to get as high intensity compared to somewhere or something like maybe deep in the glute or in the hamstring. And also the stage of the healing. will affect your intensity. So more acute injuries, maybe a little bit more irritable. And again, you may want less total energy dose if it's still fairly early on in the healing process. We tend to do, if it's acute, we tend to do, it can be anything from 500 to 2,000, again, depending on the player. Normally it's around 500 to 1,000 impulses, and we'll have a lower frequency and a lower intensity. Whereas for the more chronic injuries, we tend to do between 2,000 and 3,000, normally 2,500. Again, we'll have the frequency on 5, and the intensity will vary depending on, one, the area you're treating, and also the individual that you are treating. It's important that while you're treating, we constantly ask the player for feedback to guide our dose. If you ask them, well, we may do 500 and ask the player, how are you feeling? And if they say, yeah, I'm fine, we'll carry on with the treatment. You could possibly do a quick objective test to see if there's any change. If they're happy to continue, by all means continue. And again, you're looking at the player's reaction. If they're wincing and it looks like they're visibly uncomfortable, then you may want to reduce what you're doing. I personally have had it on my elbow, and I can remember I was breaking out in a bit of a sweat, which I think I did 1,000 hits, 1,000 impulses, which if I had to carry on, I think I would have passed out at some point. In terms of how often we use the Shockwave, oh, sorry, just 1 second. My apologies. Sorry, in terms of how often we do it, although there's some side effects reported, such as obviously numbness, tingling, discomfort during, sometimes after treatment, personally, I've never experienced anything adverse other than a bit of discomfort during the treatment session. I can't think of anybody where they've come in the next day complaining of discomfort after the treatment. And we actually get more treatment soreness as a result of manual hands-on therapy work. Obviously they don't like being prodded and poked. Because of this, in theory, and the lack of adverse effects, for us, we can use it every day. But it's important to realize we're working with athletes and sportsmen and women who are used to mechanical load being placed on the tissues. So quite often they can tolerate the shockwave therapy on a daily basis if needed. I'd imagine if you're working in private clinic or you have a more sedentary person, you'd have a much lower tissue tolerance. So maybe back-to-back sessions, consecutive days would be too much. So you'd have to think about giving them a bit of a break in between. But we do regularly do it on consecutive days. We never tend to do it more than 2-3 days consecutively. I think that's the most I've ever done it, 3. And then we'll have a break. If someone's coming in as part of a general maintenance treatment, we'll try and do 2 to 3 sessions a week, which I'd imagine would be quite similar in private practice. The shockwave therapy sessions rely on player interaction and feedback, as we said earlier. So obviously if they're feeling discomfort, you might want to think about what you're doing. So I'll always say to the player, obviously when we first start, when you feel your pain or sensation, let me know. We'll stay on that spot. And then when it goes, let me know and we'll move on. In theory, this sounds quite easy, but sometimes the player's not always fully engaged, particularly if they've had a hard session and they're just a bit, tired and switched off. Majority of the time, it's because they're on the phone and just not paying attention. But when you do find a spot within the tissue, you will get some sort of response. So we find quite often that you'll get a bit of a, you'll find a spot and you'll get like a bit of a twitch response, almost when you, similar to when you're doing acupuncture. So you'll get a little response within the tissue. More commonly, if the player is on the phone, you'll get a bit of a scream or a swear word. Well, that's their own fault for not paying attention. We always explain to the player beforehand that we are looking for their pain and their discomfort, and that they will feel some discomfort within the session. But again, we tell them it has to be tolerable. We don't want them obviously gripping onto the bed and screaming in agony. If it's too much, let us know. Majority of the time, this isn't an issue for the players, because obviously they want to be in training, they want to be playing matches, and 9 times out of 10, they're more than happy to try anything that will allow them to do this. So a bit of discomfort isn't really an issue. More often than not, the focused shockwave therapy gives us excellent results. Sometimes immediately, you get that little bit of a wow factor on certain treatments. Or if it's not straight away, it's normally within a few sessions. That being said, if you have something that's very chronic, like a tendinopathy, don't get me wrong, you do get very good results in a short space of time. But if you've got something that's quite chronic, it can take quite a few sessions to clear up, just because they've had it for such a long period. One thing we'll do, we'll use objective markers to monitor change. So it could be something so simple as, right, a player comes in with a bit of tightness in the hamstring, do a hamstring stretch or a leg swing. We'll treat them, we'll get them back off the bed, they'll retest it. And if they can feel that it's actually better, it has such a powerful effect, because straight away they buy into it straight away, because they know it's working and they can see this change and feel the change. We've had this to the point where some players have actually come in specifically asking for focused shockwave. They never know what it's called. They'll come in and say, can I have the machine? And they'll do a bit of a skippy clicking noise. So they'll do this as they come in. So it's like, oh, shockwave, right, okay. So we'll do it with them. And actually, as I mentioned, we do have some players who don't like the deep tissue release, as it can make them sore the next day. And we have some players who don't like acupuncture. So these are the players who actually will prefer this treatment. Again, a typical session with the Piezowave, it's 5 to 10 minutes, 15 minutes max, depending on the number of shocks on the frequency that we use. But again, it's not something we tend to do as a standalone treatment. It's done alongside other treatments and modalities. This is where we're lucky that, one, we know the players that we look after very well. We know their injury history. We know their complaints. And we have the time with them. We actually spend more time with the players than we do with our own families. So because we know them so well, when they come in with an issue, we can use the shockwave and we can identify areas that aren't usual for them. Someone said the other day, the kitchen sink is our friend. So although we use the shockwave as a treatment, again, it's used alongside a lot of different treatments. So for us, we need to get the players back as quickly but as safely as possible. Sometimes in football, we can be guilty of using treatments that don't necessarily have the best evidence, but clinically they work and make the players feel better. So if it helps and it's safe and the player wants to do it, we'll do it. It brings us back to those 1%ers and the marginal gains. The only thing is that this may lead you to ask the question, how do we know it's the shockwave that's having an effect? Truthfully, we probably don't know that it is purely the shockwave, but we don't have the luxury of just using the shockwave alone and assessing its effects. However, that said, the players like it, their opinion of it is very high. They feel good after it, and the results we see post-treatment do actually speak for themselves. So I do think it is very good. In terms of the cost of the actual unit, it's there's something I was just discussing with Dom. It's assumed that Man City, obviously one of the richest clubs in the world, we have an unlimited budget and we're able to buy every piece of kit available. Money's no object. Unfortunately, this isn't the case. So as a medical department, we only really tend to invest in equipment that is beneficial to the players in our care. And this is why the Shockwave does get a lot of use. I can think of pieces of kit and equipment where we've trialed it in the past where either the players haven't liked it or the equipment hasn't really made any impact. It's then ended up sitting in a corner somewhere before it gets returned. None of it was from Piezowave, just in case you're wondering. I don't know the exact cost of the unit. I don't think it's cheap, and it's easy for me to sit here and say buy one. Fortunately for me, at the club, I don't pay for the equipment. But from our point of view, it is a great piece of kit, and we need equipment that will get players back as quickly as possible and help us give us an advantage over other teams. If we can keep players fit or get injured players back quicker, it gives us a bigger, fitter squad to select from. This allows more rotation of players and hopefully reduces the number of injuries, especially in a season like the one we're having now. And the fact that the players like it and we get very good results using it, we are much more likely to invest in a piece of kit if we are seeing this. So yeah, so that is pretty much it. In a nutshell, we do really like it. Think it gives very good results. The players like it, and it does help get players back quicker and keep them on the pitch. So yeah, I hope that helps. And if anyone has any questions, by all means, fire away.
Perfect. Thanks, Anthony. Really appreciate you going through that. Very interesting information. It's always good, I think, to see just how it's used in elite sport. It's slightly different. It is slightly different. But as you say, we're now going to open up the Q&A. So if you do have any questions, there's a Q&A function at the bottom of the screen. Please pop them in there. We do have some pre-submitted questions already from people who can't make the live session. So we're going to crack on with them initially, and then we'll see what questions come through. So Anthony, first and foremost, like being part of an elite sport club, it's going to throw up some challenges that a lot of people probably aren't aware of in sort of the normal world. So what are the biggest challenges that you face in managing injuries in elite sport? And there might be a few, but what are the sort of the biggest ones?
Well, the biggest one at the moment is obviously the current season we're having. Obviously with COVID and a shortened season. This season in particular has been very hard. We had a lack of a significant pre-season, just the sheer number of games. Like I say, 1 week in December and this week have been the only weeks where we haven't had 2 games a week. That's resulted in limited rest time between games. And the problem with this as well, if we do get a player who's injured and maybe misses 2 weeks, they could potentially miss 4 to 5 games. So that's where having equipment that gives us good results has been absolutely brilliant. Other issues, player expectations. A lot of the time, as soon as players feel good, they want to push on with the rehab. Sometimes it's too quick for their own good. So we have to try and keep the reins on them a little bit and educate them as to why a program has to be quite graduated, and just explain the risks involved with going back too quickly. Again, the expectations of the management, they want the players to be fit. The more players they have to select from, the better for them, really. We're very fortunate here that the manager and the coaching staff are very, very good. They have faith in us as a department, and they don't really pressure us, or never pressure us to get players back. They never put us in any uncompromising positions, try and put a player back into training before they're ready for it. This is where it's great, because we have a very good relationship as a department with other departments and the management. So if ever it does come up that can we get a player into training or get ready for a certain game, it's an important game.
Yeah.
And we're able to discuss as a department with the coaches and the manager, and make and the player actually, sorry, and make a collective decision and weigh up the pros and cons and the risk reward, really.
I suppose as well with like sport is that you got a player that's injured. It's you have time with the players because you can see them every day, which is something that in private practice you don't have. But it's kind of seems that you have time, but in the same breath you don't have much time because they need to be back as quick as humanly possible. I suppose that throws up its own challenge, doesn't it? Is to, like, say the kitchen sink is your friend. You know, if you can try and almost get whatever it responds to, and having something that can get you that result in 10-15 minutes is the little wins, I suppose, as well, with the more sort of long-standing ones where it can become arduous. It's the little wins, because
definitely,
I know with players they don't want to be in the physio room, especially injured. So right. I mean, just sort of moving on from that perspective, in terms of like the other modalities that you have access to, you mentioned there's some that you get access to that you just don't end up using. It doesn't have the impact. I mean, how does Shockwave fit in to the other modalities that you have?
Well, really, to be honest, we do a lot of hands-on manual therapy treatments. Obviously, we've got the Shockwave. We have a few other bits of electrotherapy. So we have a TechR machine, which is very good, which we use alongside the Shockwave. We have other bits of equipment. So obviously things like if we have a bone injury, we've got Exogens, and we have a couple of pain modulating machines. But a big emphasis as well is on sort of exercise therapy. Although we love the Shockwave and we'll use it, it's not all about electrotherapy. I think there's a misconception sometimes that players are happy to come and sit on the bed and just have passive treatment all the time. And don't get me wrong, they do get some passive treatment, but we'll try and get them in the gym and get them moving, and try and work on things that could be contributing towards any issues that they do have. Again, we are very fortunate that, one, we have access to all this equipment, but we've also got a state-of-the-art training facility. So we have access to things like pools for recovery. We've got a top-class gym with CV equipment, weight equipment, Pilates equipment. We're lucky that we have access to great food. We have nutritionists who make sure the players are getting everything from a nutritional point of view. Have rooms within the training facility where if it's maybe a game at night and they're training in the morning, the players can go to the room and rest. So we are very fortunate that we do have access to basic top-class facilities and equipment.
Yeah.
But yeah, the Shockwave, in terms of the machines we use, the Shockwave, I tend to use the TechR predominantly with the Shockwave and then hands-on.
Yeah.
And find it just gives us very good results to then get the players in the gym, get them moving, and work on any areas that they need to work on.
Cool. That's good that it's one of your staple treatments. I think it was, I remember James Baldwin, when he first got hold of it, it's like, it's kind of standing the test of time, which I think in particularly football it's one of those things, like you say, some things just end up going further and further back into the corners. So it's nice to hear that it is still being regularly used. I wanted to touch back on like a couple of points, or one of the particular points that you made, is that there's no one size fits all, which for me as well is, I love that fact that we have got the protocols, the guidelines, which is a really good start point for a lot of people, because as you mentioned, there's so much information out there, it is quite overwhelming. And to try and derive some of that information into a treatment protocol is really tough. And you're talking about how you've got it seems to be like there's a balance between that guideline and your clinical judgment of what's facing you, and actually working with that player. But the question I've got is, how long did it take for you to get your head around? Like, was that once the penny dropped, was it like, oh right, okay, this makes sense, or was it quite an arduous thing? Was it quite easy to pick up?
Yeah, I think it's one of those pieces of equipment that the more you use it, the more confident you get with it, and you start to see little patterns, and you start to get your own, like my settings may be slightly different. You mentioned James there, he may be slightly different. And you just get a feel for it, and over time you think, well, last time I used it for this, it worked. And sometimes the only problem we may have is we don't necessarily see the same injury frequently. That makes sense.
Yeah.
Things like the Achilles tendon, it worked well on this player's Achilles tendon, but then we might not see an Achilles tendon for quite a few months down the line.
Yeah.
As in private practice, you're probably seeing quite a lot of Achilles.
Yeah.
Quite a lot of this injury and that injury. But the good thing is, like you say, once you've got an idea of what settings and the intensity and frequency and how many impulses to do, you can then roll it over to the next one. And a lot of them are very similar. It's just clinically reasoning what stage of healing you're in, what you're trying to achieve. Therefore, how can I sort of tinker it for this specific injury and individual?
Yeah, which say quite a lot of it's a bit of common sense as well. Like once you like you say, if the player's finding it too uncomfortable, you don't keep it that. You put the energy off, and vice versa. If they're not really feeling anything, you kind of go, oh, okay, we'll pop the energy up here a bit and see if we can get a.
Yeah, exactly. It is a little bit of trial and error. But again, you could have he could come in 1 week, a player with, I don't know, tightness in his quad, and you're using the linear, and you get up to, I don't know, 12, 14. And then the next week, it could be completely different because he's not as irritable, or he's a little bit more irritable. And it is, the more you use it, the more competent you become. And again, as I said at the start, having watched some of your webinars with other people, the knowledge of the people was absolutely frightening. And I don't consider myself on that level, but touch wood, I've had good results. I haven't managed to make anyone feel worse after treatment.
Well, I mean, on that, it's like the knowledge level is, I mean, I don't put myself in that category either. I've done a lot of reading, but, there's people like Anna's Brogards. For anybody that hasn't seen the webinars, I'd recommend going and watching one of them. But it's a very, very safe treatment. As long as you're not being daft, like you're not treating over lung space or anything, crazy. If you're treating soft tissue, it's so safe to use. It's mechanical energy, so there's not much that you can do wrong. We've had a good question come through from Helen Conley. Have you found that shockwaves help prevent the recurrence of injuries? Or is it difficult to say?
It's difficult because a lot of the injuries, I get the little niggle ones. I think it's very, very good. So like the things like the player might come in feeling tightness. What we've got with football is a lot of them are traumatic injuries. So the player with the MCL obviously went out and got back no problem, but there's no guarantee that in the next game he's not going to get absolutely walloped by another player and put a valgus stress in that MCL. So it's hard to say, yeah, it stops the recurrence, but it definitely for me, it definitely maintains the players. So the players will feel an issue and we use it and it helps. And then it could be a couple of weeks or 3 weeks before they come back in and ask for it again. But they sort of know that the last time they had this treatment, it helped.
I suppose a lot with preventative recurrence is exercise, strengthening, improving range, improving proprioception, all that kind of thing. So it's like, I mean, Shockwave, I was going to touch on it a bit. There seems to be like sort of two areas that you're working on really with Shockwave. There's the one which is modulating pain and ensuring that players are kept available. And then the other side is supporting that healing process and tissue regeneration. There's kind of those two pillars of where you're using it. And the prevention of reoccurrence is probably sits more in that rehab side of things. And are you kind of using Shockwave to support with the pain modulation, and the exercise rehab is more, you know, with the strengthening and that kind of looking at your prevention?
Yeah, that's what we I'm sorry. Just say that last bit again, Dan. I'm sorry, someone
so yeah, you're looking at preventing reoccurrence is more your strengthening and your flexibility and that kind of thing, ensuring they're obviously hydrated and properly nutritioned.
Yeah.
And your Shockwave is more just managing that pain to ensure that that player is physically feels good, feels better. You're scanning to ensure that the structural integrity anyway.
Yeah.
So, you know, from a prevention, it's difficult to say and quantify, isn't it? Because you don't know you're preventing something until something happens.
Well, yeah. Unfortunately, that's with football and contact, that's the nature of the beast.
So one of the other questions that's come in, I don't know if you had any experience with this. So Ramon Holland has asked, have you got any experience in using focus Shockwave in athletic groin pain or pubic bone edema in season? And if you have you found it effective in keeping players on the pitch?
No, is the honest answer. We have used it on adopters, but more for, again, as part of the maintenance. And we do find it, as I said earlier, keeps players ticking over. It finds these little trigger points, sensitive areas, and helps with that. In terms of what you just said there,
the pubic bone.
Yeah, we haven't really had any issues with that at the moment. It's something where I would be inclined to use it, I'll be honest, if we do have that sort of issue. But touch wood, we haven't come across that just yet.
One of those where I think it's the thing in football, isn't it? You don't want those injuries, but you want the device there that if you do get it, you've got right. I've got the system that I know can fix that. It's like it's one of those catches, isn't it? You don't want the caseload.
No, definitely.
I mean, to add on to that, there are clubs that have used it on pubic bone symphysis and pains and stresses in that region to very good effect. These are ultrasound guided. As you mentioned before, so you can precisely target it because it is quite deep. So yeah, there are professional clubs in the UK that have used it on pubic bone and used it very well from that perspective.
Good to know.
So one of them was a fracture. I remember getting a call actually about using it on a fracture. I mean, tendinopathy. When we talk about Shockwave, naturally the association is tendinopathy, but there's more people now. You mentioned about there being evidence with meniscus and obviously ACL. And there's a recent paper that I had seen on that. Just with the stress, the bone fracture, you're able to sort of like divulge a little bit of how effective it was with a fracture.
Yeah, I think I mentioned this to you a while ago that it was pre-lockdown actually. We had a player who had a very, very small fracture after he came back off international duty. And we did a couple of sessions and we were getting very good results. But then obviously we went into lockdown and it just obviously resolved itself while he was at home. But it was something where in the past, I never would have thought of Shockwave. We tend to use the Exogen, which is obviously the low intensity pulse ultrasound. It was always Exogen. Whereas now this just gave us basically an extra to use. We used it, I think we did 2 sessions. As I said, on the machine, obviously it goes 1 to 20. If you press a button, it then goes 0.1 to 0.9. So I think we initially were using it around, I want to say 0.3, 0.4.
Mm-hmm.
A bit of awareness. And again, it was one of those where, as I said, the more you use it, the more confident you get, the more competent you become.
Yeah.
Because it was the first time we'd used it on a fracture. I think we may have been quite conservative, but it did seem to make a difference to the player. We never got a chance to sort of re-x-ray it sort of after the treatment before the lockdown. But again, based anecdotally on that, it's something that I think we would do again, definitely.
Yeah. I mean, interestingly, from that perspective, from a lot of the reading that I've done, it's like, you know, Achilles tendinopathy research, depending on the papers you read, are actually kind of hit and miss. I was really intrigued to see that the research behind delayed union and non-union fractures was really strong in terms of stimulating new bone growth. So for those who, you know, come across a lot of sort of stress fracture related injuries, today I've been to a physio clinic that deals a lot with dancers and performing arts, which that's a big sort of one of the big issues is stress fractures and stress related incidents. So yeah, it's certainly one to look at for people. And one of the things I wanted to ask, so from the club's perspective of like adding equipment to clinic, one of the challenges that face probably a lot of departments is obviously cost is one thing, and we've kind of spoken about the value and the value that you guys see in it. But a lot of clubs will have already bought a radial device. So in the eyes of the boards and the powers that be that have the purse strings, they will see what you've already got. Shockwave, so you've already got one. You don't need this.
Yeah.
How? I mean, I don't know. You know, I don't know what the decision making process is at Man City, but you know, for those who are thinking, you know what, Focus Shockwave, I want my piece of this, and actually trying to add this to clinic, how would you sort of go about, and what would be the advice that you give to people to say, you know, how can you help get Focus Shockwave in the door, really?
I mean, for us personally, if we can justify cost, obviously in our world, if a player is out for 4 weeks as opposed to 6 weeks, the money that's involved, both in player wages and the rewards of winning leagues, winning trophies, is very, very high. So we can justify that this piece of equipment is going to help us, one, get players back quicker, and two, hopefully keep them back, prevent them using it as part of a maintenance treatment. Then it gives us a very strong case to say this is a good piece of kit. The facts, again, I don't have much experience with radial shockwave, but the fact that this can be tailored to so many different injuries and so many different areas, we can justify again that we're going to use it a lot more than potentially we would have done with the radial, because there's so much variation with the different therapy sources and the gel heads. So for us personally, it would be a bit of a no-brainer to say it works, it gets the players back. Yeah, it's expensive, but in the long run, it's saving you a lot more money.
Yeah,
because the players are getting back in.
Yeah.
But again,
oh, go on. Sorry.
I was going to say from a private practice point of view, I suppose it gives you an extra tool that not everybody will have. So it is a bit of a unique selling point for your clinic. If you've got this bit of kit that not everyone can do.
Like Man City have got a good little bit of marketing there.
Well, yeah,
although you can't use the badge probably because of.
But again, it gives you a unique selling point. You can probably use it on conditions where you may not have been able to do what you may have had to go for, I don't know, an injection or potentially surgery. So again, you're sort of saving on cost there by outsourcing to other, for us, sending him to see a specialist, or got to have surgery and they're going to miss X amount of weeks, whereas we can try this now and we'll get them back much quicker.
Almost use that as your first line, say, right, if they respond to Shockwave, brilliant, you know, they don't have to be referred out. If they're not responding in 2-3 days, then it's like, well, what's 2-3 days if they've got to go off and have a surgery anyway? You'd rather try something first, I suppose. I think just to add on with that, I mean, I want to be clear sort of with radial and focus, like we're not saying that one's better than the other, because they are two different systems. For those who aren't familiar, radial's pro-inflammatory, whereas focus is more about tissue regeneration and activation. So they actually complement each other very nicely. So I know obviously you don't have the experience with, we've had clubs that have got radial and focused, and one of their sells was the fact that, you know, when they put the technical aspects in front of the board, they're probably not going to get it very much, but when they put it down, they look, they actually complement each other, will get better results and get people back quicker by using both. We already have one, great. If we can just get this other one, it's even, you know, even better. And like you say, you get to treat a lot more. And just that last thing about player buy-in. So you mentioned obviously about players, you know, how big is that? Because obviously if you're replicating their pain, and that wow factor you talk about, is that how important is that psychologically for the player, but also from a trust building relationship with you as the therapist, the physio there?
Personally, I think it's very big. Players are quite stubborn, and they know what they want. If they like something and think it's beneficial to them, they're going to use it a lot more. We have some players who, like I say, they don't like acupuncture. Some players don't like deep manual therapy. Some don't like manipulation. So if they don't like it, they're not gonna try it. And footballers are, I think, the creatures of habit, whether it's treatment or they'll have the same pre-match before games, and they know what works for them. And I think if they're having a treatment that, again, a bit of discomfort, they'll more than tolerate the discomfort. But if they know it works for them, going to potentially keep them on the pitch, keep them in games, they're more than happy to do it.
On the discomfort point, actually, because I've seen this today, done a couple of treatments today with Shockwave, and see this all the time. When you hit that point of discomfort, and it can be a 6 or 7 out of 10 for that player, it can be really uncomfortable. Do you see it where they, you know, let's say you're treating the plantar fascia and every other part of their body is squirming, but the point that you're treating doesn't move a millimeter, it stays still? Have you seen that quite a bit?
Yeah, we have seen it, definitely. And
I find that speaks volumes, that they can. I've had it today, though. It's screwing all over the bed, tolerable, but you know, you do get, like you say, get some of the expletives. But it's quite odd because we did a shoulder today, and everything else, legs were squirming, shoulder never moved. They stayed exactly where they were, and they said today, it was, you know, sort of quote unquote, it was exactly the pain I was getting, and you know, there was just no hesitation. Obviously, if it became too much, you'd move off, but because we found that sweet spot, it was just that, it was like, yeah, that was exactly the point that I was getting. So I was happy to kind of work through it.
No, definitely. And again, that's where they buy into it, because the fact they're feeling discomfort, they know something's not right, and it's helping them. Especially
the niggly ones, when you know, you can palpate as much as you want, and you're kind of like, all right then. And as soon as you hit it, you're like, they're not mad. They're going, I'm not mad. There is something there. I suppose that's quite powerful as well.
Oh, definitely. And I'd say if anyone ever has chance to use it, have a go and see how it feels. It is a unique sensation.
Oh, for sure. Well, look, Anthony, I think on that, I think it's a good point to wrap up, really. So, look, thank you very much, Anthony, for your time and sharing your experiences with it.
Pleasure.
And thank you for everybody for joining the session this evening. Following this, you'll receive an email with a survey along with the link to the webinar recording that we've just done, and also some of the links to the previous webinars that we have done on the physiological impacts of Shockwave in different areas. Regarding the survey, we really appreciate your feedback and any suggestions for future webinars or future sessions. So please just take a minute or so just to fill in your feedback. Anthony, have you changed? Oh yeah, perfect. So we have another upcoming webinar. It's really interesting. The importance of monitoring hydration during training. It's with Professor Lee Ward, a very experienced person with bioimpedance, and then Dr. Alan Ruddock, who is also the Boxing Science Performance Center up north. So they've worked with several world champions in boxing. So it should be a really interesting one, looking particularly at athletes or training and how you monitor hydration. If you do have any further questions about the session that we've done today, then please feel free to email us at info@physequip.com. Any more information on Piezowave, Focus, Shockwave, you want to try it yourself, then please feel free to reach out. You can have a chat with myself or any of our other specialists, and we can arrange a demonstration so you can try it. In the meantime, Anthony, good luck. Hopefully you get the Premier League wrapped up.
Thank you very much. Fingers crossed.
And yeah, we'll speak to you soon. But again, once again, thank you very much for your time.
Thank you.
Thanks. Have a good evening, everyone.